Dear journalists, hello. We start our press briefing. We'll talk how to stop the epidemic of polio, which is already in Ukraine, and I'll remind you that over this week we've been talking rather actively about the reform of the public health, and yesterday we touched upon the polio issue during the roundtable. Today we'll dwell on it, and the speakers are Olga Bogomolets, MP from the Petro Poroshenko Bloc. She is chairperson of the Parliamentary Committee on Public Health, and she's advisor to the President of Ukraine. Also Dorit Nitzan, who is the World Health Organization representative and head of country office in Ukraine, and Dragoslav Popovic, who is a UNICEF representative in Ukraine. Good morning, dear colleagues. The topic is extremely important, as regrettably today the Ukrainian society has such a level of mistrust in what's happening around, including what concerns the health ministry and the parliament and the media field, that this public disunity can lead in this specific case and in many other cases to very negative after effects that will impact not only on health of our children, and not only the international image of Ukraine, but also on the possibility and opportunity of us to join the European Union. You might think, what's the connection between polio and the international development of Ukraine? It's a very direct connection. The regional reference laboratory of WHO has confirmed that 2 of the kids from Transcarpathian region who were not inoculated do have a virus, and the top officials of Transcarpathian region said that they do not recognize the fact of polio on the basis of clinical observations, but the virus is here. This is confirmed by WHO laboratory. Those kids have not died, but they are paralyzed with a high level of mutation of the virus. If you have any questions about mutations and inoculations, I'll be ready to answer. Let's analyze what has led to such a situation, and these are key aspects of how in the future we can avoid such situations. There were 2 key events or even processes. First, non-fulfillment of the programs of vaccination of children by the Ministry of Health. Starting from 2008, the inoculation of children in percentage has continuously dwindled. It used to be 80,000, in 2011 54%, and in 2013 74, while in 2014 it amounted only to 17% over several months. The first reason for this is lack of vaccine, and the second is the conscientious refusal of parents from vaccination. And this second component is linked exclusively to the negative attitude formed on the basis of articles, television items of mass media who have reported only on negative effects of the inoculation. Regrettably, over the last years, there was no positive information in mass media about how much we need those vaccinations and how this can positively influence the development of health programs. So As of today, the responsibility should be shared by the mass media who provided negative information and formed a negative opinion among the population, and the Health Ministry who have not performed their duty as far as the purchase of vaccine is concerned and all this kind of stuff. So now I give the floor to representatives of two powerful organizations who will help Ukraine to cope with the flare of polio, which has again put our country into the next red book of countries where there are possible flashes of polio. And we'll talk about after effects, possible after effects, and the urgent actions that we should do today. The control over the polio, including the question how not to allow for the epidemic in Ukraine, depends not only on the Ministry of Health, it also depends on how the mass media informs people on the fact that their kids need vaccination, how the sanitary service and the educational establishments agree the process that has to happen in Ukraine over the next months. And I give the floor to Head of Country Office in Ukraine of the World Health Organization, Dorit Nitzan.
Honor, Excellency Dr. Olga Bogomolets. It's a great honor for us to be here with the Parliament member who is leading these special efforts of Ukraine. It is really important for us to explain what is going on here, because we hear of many conspiracy theories flying around. So I would like you, the media, the people, to clearly understand, to ask us openly the questions so that all the people will be able to save the children in Ukraine. It sounds like a strange story, but this is real, and it's here and it's now. When we have a small virus like polio that can be beat and totally eradicated in few months from the earth of this beautiful country, this should be done jointly, quickly and effectively. No one should wait even a second. So why do we have it? We heard already from Olga Bogomolets, and this is something that I try to call poliotization. Like, you know, it's a combination of very, very strange ingredients of suspect and untrust in governments and health authorities, in doctors, that is deeply rooted in years of theories and lack of access to the services, from one hand. Probably it has to do with good governance and corruption. Somewhere they're pushing and fueling the system to oppose the right things. And then parents who love their children that get confused and didn't know what to do, so they opt not to vaccinate, because for so many years they lived without any exposure to polio. They don't know how children that got paralyzed because of polio or died, what terrible life they have ahead in many cases. These parents, not to be blamed, but these parents have to be helped now. Then we have the physicians and the health workers in the country. You know, in the past they were blamed. They were blamed that they are vaccinating kids and the children get sick after that. Some of the doctors, 1, 2, 3, were even put under investigation and in prisons. This conviction, this fear, led them not to push further, even though deep in their heart they do believe that that's the basic public health tool we have worldwide. Believe me, we have no interest in the world. We don't have any market interest. We are really, really objective. UNICEF, WHO, the UN system, and thank God for the people in Ukraine, those who are really, really pushing for this. No one else should worry. We are really worried about the children. So what we ask is to untangle this mess of poliotization, of popular use of polio, so you know you can play even more with these words, to cut this and to look at the health of our children. WHO, UNICEF, and the UN family here are standing by to support the country. We want to ensure that every child from 0 to 71 months of age, at least in the start of the campaign, will be fully vaccinated against polio. We want to urge parents not to forget that there are other vaccines that should be in the program, and to get the system on track very, very quickly. I thank you. I'm short now, but I will be really happy to answer questions. And yes, Dr. Popovic.
Yeah, thank you. Thank you very much, Madam Excellency. If I may, just a little correction. I'm not diplomatic representative of UNICEF in Ukraine, but I'm a senior UNICEF technical advisor on vaccines and immunization, and I hope I will be able, with my colleagues, to answer any of your questions or concerns. So what we have now is, on the September 1st, we declare the outbreak of circulated vaccines-derived polio in Ukraine. By international criteria, this qualifies for so-called level 3 public health emergency. This emergency has been declared in the country, and there is no room for any discussions whether this has happened or not. The investigation on this outbreak goes on for since the 27th of June. We now have all evidence, including from laboratories in the region and in the United States, confirming that the virus is in circulation. What that means? It means that all children in Ukraine are under risk of getting poliovirus and developing symptoms against the disease. Why I'm saying all children? Because we all know that for more than 4 years, the vaccination against polio and also other antigens in Ukraine was not going well, and we have reached only 40% of the kids on average, while over 90% coverage is required to provide this collective protection against the disease. So every kid is under danger. The virus is positively in circulation. We have identified through the genetic sequences of the isolated virus that some passed 8, another passed 18 mutations, and were in circulation among the kids for more than 2 years. We are very lucky to have a system in Ukraine at different level to help us detect this case and do the laboratory analysis, some of which can be done only in the places like in the CDC, Atlanta, and nowhere else. As I'm saying, this is the problem, which is very serious. I think we need mobilization on everybody to understand the public health emergency, to react to that. Why is this important? It's important for parents, for the kids, to get immunization as soon as possible. It's also important for this government to show that they can cope with the crisis and they can react quickly. The international public health emergency, by the international regulations, which are basically adopted by all countries in the world, is providing very clear steps in the process. We now have advisory to everybody in the world traveling in and out of the infected areas that they need to boost up their immunization. But if we act quickly, these limitations will be lifted. If we are not acting quickly and if we're delaying the action, the international regulations may broaden on travels of people, may broaden on the trade and exports of this country, and we don't want to see that. This is why we need urgent action of everybody to stop the outbreak. The solution is very easy. As my colleagues were saying, it's the vaccination of children against polio. We were preparing together with the government for that. We were preparing for vaccination to start on December 1st. We didn't know that this will happen. This is requesting us to change the focus, to shift the focus a little bit, but we do have now resources, we do have now vaccines, we do have trained people, but we have also, we need right now clear determination, and we need right now clear messages that would go to everybody so that we all work together to make this happen very quickly. And the role of the media is extremely important, as Madam Bogomolets and Dorit were mentioning before. I know that media is just transferring information. I know that media is not creating speculations, but I know also that media needs very clear information to be given, and we really encourage you to ask us any questions you have, so we will try to give you information from the first hand. Thank you.
Коротенький підсумок. Що ми зараз
To sum it up briefly, what are we waiting for to see from the Ministry of Health and the Council of National Security? What quick steps they have to undertake? They should put together a schedule of vaccination of children all over Ukraine. Vaccine does not need any money from the budget. It's been transferred to, handed over to Ukraine as humanitarian help to the tune of our needs for the kids. So the matter is in the organizational process, how quickly the health ministry and other structures can provide for the delivery, storage, information campaign, and carrying out of vaccination for children. These are the steps that should be done here so that Ukraine avoids international after effects if the diagnosed cases of polio continue. Irina Markeev, Twitch, my question to Ms. Nitzan. Last year when we talked to you, you said that a representative from Romania will soon be in Transcarpathia. Is this person there, and what are they doing there? Do you see from that the Ministry of Health has really started to act, and that they sent this humanitarian vaccine to Transcarpathia?
Our expert from Romania is on his way. He's just getting to Kiev first. We actually asked him to come here to Kiev and to meet with the authorities before going to Zakarpattia. We needed to look at the lab and collect all the information so that he will be able to follow the contacts of the children. The permission is given also from the Ministry of Health. We are working really closely with the Ministry of Health, and yes, everything is working in the right pace. We have timelines, as I told you. We called it SOP for the response, and we are following it very strictly. Once we don't move in the right pace, we will let you know.
Дякую. У нас є ще одне запитання, прошу.
Канал Україна. Два коротеньких запитання.
Ukraina channel. You mentioned international after effects that may happen if the epidemic is not overcome. And still, is it an outbreak or an epidemic?
Previous question, it's not representative of Romania, it's representative of WHO, who is just staff from Romania. And I have to say that we here in the country, together with the government, can handle this situation. And we are working on that. The question on the outbreak is there's absolutely no discussions about that, whether it's outbreak or not. And now we have colleagues discussing about the diagnosis, they're discussing about the clinical symptoms, but this has nothing to do with the confirming or not confirming outbreak of the circulating polio virus. The confirmation of the virus in circulation in the society and in the environment is going to be done in a completely different way. So the confirmation is here. All checks and evidence was already provided before we declared this international emergency. There's no way out, and there is no discussions about the definition.
Can I add? Yes. Can I add for a second? Yes, as we discussed also a few days ago, we know that only 1 to 2 children out of 200 children that get the infection get actually paralyzed. That means that if you think that we have 2 children that got paralyzed, unfortunately, and this is total disaster for the children, the family, and the community, these 2 children, if you just do it simply, they have 400 children already behind them that's circulating the virus. Those 400 children are in contact with other children, and the mothers and the fathers of these children are in contact with other parents. And you can imagine the mathematical model that already shows you that thousands of children in Ukraine at this moment are carrying the virus. From them, 1 to 2 in 200 will get sick. Viruses do not know border and do not know any line. They just go in the environment and they are there. Sanitation and hygiene are very important, but it's not enough. Thank you.
Дякую. Прошу.
Ви не відповіли, які можуть мати...
You did not answer what can be the international. You did not answer what can be the international consequences for Ukraine.
I can do that. Okay. Very severe. You can imagine that a country with an outbreak of polio that is not tackled is terrible. We have here a real opportunity, and I think Ukraine should be proud. The disease was diagnosed at early stage, very early stage. It's not like other outbreaks when it's recognized very late. It's very early. If it's hit quickly and in the right way, there won't be any implications. But if not, if the disease would spread, then the implications are financial, economical, reputation, and political, as well as unrest inside, as well as fear, threat. You can just go on and on. Polio outbreaks in countries are destroying the country because it has so much to do with society and the burden for many years. So let's stop it now.
Дякую. У нас ще запитання, прошу.
Reuters. Taking into consideration that the unvaccinated remaining part of kids in Ukraine, 60%, how long, you said it's only 40%?
14.
Only 14. So we're talking about 86%.
Yeah.
So how long it will take to vaccinate them, even if everything works according to the book?
That's a good question. I thank to Reuters for this and also for other colleagues. The outbreak was a major news in international media already for 3 days. Yes, the coverage was for a couple of years 40%. In this year, due to total stock out of the vaccines, is 14% for the first 2 quarters. And this is the official report. How long it will take? It must not take longer than a couple of months. We need to do by the rules. We need to do immediate campaign in the affected area next week, and then we are ready to immunize all children in Ukraine with 2 rounds of the vaccination, with a period of 4 weeks apart. So obviously this is a massive task. but it can be done, and this is not the first time we did it in Ukraine or elsewhere in the world. There were thousands of campaigns done before the polio eradication being brought to this level of only a few cases in a couple of countries, and we hope that we will stop the spread of the virus globally very soon. And this will be important contribution of Ukraine to that process.
Шановні колеги,
Dear colleagues, dear parents, all people who can hear me today, I'm not a person who is ready to get into panic. I always take very weighted decisions. At the moment when the entire Ukraine was in a panic around the flu virus, and everybody was buying a lot of medicines in the pharmacies, I carried out public awareness campaign explaining that it was not, there was no reason to panic. When I was 4 years, I was vaccinated, and because of that vaccination, I had a very bad complication of health. I got an allergy and asthma, and today I have and this lasted until the age of 14 years of my age. And today I have 4 children, and they are of different ages, and all of them were immunized and vaccinated against the most dangerous diseases, because as a doctor, physician, I understand what could be the consequences of non-immunization, because I saw in my life those parents whose children got paralyzed and they can do nothing, they cannot help, and polio is dangerous because in case of disease the doctors can almost do nothing, and we should not be scared because of vaccination, because the consequences of non-vaccination might be even more dangerous for our children. Any further questions?
Could you please, whoever can do this, orient the kids, the parents, do they have to check the card of vaccination and see how many jabs should the kids have had? First of all, I'd like to address you because I got a bunch of questions on Viber and all this kind of stuff. First of all, you should not panic. The situation can be under control and all the kids will be vaccinated. Maybe within a month or 2 months, but I'll tell you that within half a year, if the Ministry of Health works as it should, in the country which is in such a situation, all the children will be vaccinated, and the precinct pediatricians will be responsible for this, as well as school nurses who have to check the cards of the kids and see how they were vaccinated and when they should be vaccinated. So no panic. Also, please don't panic, parents of babies who are not 3 months yet. Everything should be done on the state level. People should at last feel that there is a state, there are standards, and I hope that there will be clinical protocols, which I am demanding from the Ministry of Health for over 6 months now. And I still want to hear what has to be done. Like, for instance, a kid younger than a year, how many jabs should they have? Everything depends on a specific child, because there will be some children that could not be jabbed, inoculated, and of course there will be kids that we should not vaccinate because of different considerations. Every child is an individual. They are specific and special. If, for instance, the birth was given early, then the calendar of vaccination should be reviewed, because they cannot actually, they might not survive or be affected negatively by the jabs. We should treat every case individually.
The critical issue at the moment is that every child gets the oral polio vaccine at some point, as soon as possible. We are planning to issue a very detailed information about that. We are very much aware that in Ukraine it could be a small percentage of the children that are immunodeficient, and those immunodeficient but only proven immunodeficiency could be a counterindications for the vaccination. In any case, we have in the country oral polio vaccine in sufficient quantity. We have also a history of use of inactivated polio vaccine, which is a different type of vaccines against the disease that helps to reduce any possible risks to zero. Any additional dose given to the child would not harm at all. You can get 5, 6, 50, 60 doses of vaccines. It not makes any harm. So everybody will get a polio vaccine, and you know, if some get some additional doses, you know, and if there are no contraindications, it would be perfectly fine.
У нас є час ще для пари запитань.
A couple of questions, Radio Liberty. My question is to Ms. Bogomolets. You have just mentioned in passing the fact that if a child is already infected, then a doctor can do pretty little. But what can you say about if the child is already infected, what the kids, what the parents can hope for? Infected and ill are different things, because a carrier of the virus or an infected child is not necessarily the one who will become ill, because we are immune in many cases, and according to the world standards, out of 100 people, 30% will just reject the virus and it doesn't get in the body. 30 to 40% may become carriers of the virus, but their internal system will overcome it, and only the rest can become ill. If a child, well, you know, the illness, sickness can happen in different ways. It can start with a high temperature. There may be different disorders, and it is being treated symptomatically. So the urgent task is to vaccinate a maximum number so that immunity works there. And the problem which I see from the internet, many people do not see how the vaccination can provoke sickness, but the matter is it's a peroral and fecal way of carrying the virus. If they don't wash their hands, if kids touch their sexual organs and then touch their lips or tongue, even after the immunization of a child, after the vaccination of the polio, the doctors say, please follow and observe the hygiene of a kid very closely, because the virus is being produced in a fecal way, and the virus that gets to the environment continues to live there. And of course, if 90% of kids are vaccinated, then it doesn't harm them in any way, because the body does produce immunity and knows how to fight the virus if the virus again gets into the body. But the kids that were not immunized, they meet the virus that lives its own life. It multiplicates, it lives and lives and lives, and then suddenly there's a genetic mutation. Something becomes different, then a bit different again, and then again. And you know very well what will become to a tree if you cut the top and there will be offshoots, uncontrolled, so-called wild offshoots. The same thing happens to the virus because it becomes wild and becomes very active. Why the WHO is so disturbed? Because the viruses that were detected, the two cases, have a very high level of mutation, which means that the virus in the nature, in the environment, has become more active and more. So the issue and the task is to create a powerful immunity in children, and those kids whose immunity system is weak, then they won't be vaccinated, but they will need more hygiene from their parents, because you can lower the risk by lowering the risk of getting the virus through peroral or fecal way. At the Committee for the Public Health of the Parliament, we have issued the address. We appealed to the President and the Council for National Security to take it under their personal control and create a special group that will help the Minister of Health to work according to a special schedule, so that all the parents sleep well. They know that pediatricians will do whatever they were taught to do. And now the last question.
And again about doses of vaccine, whether we have enough, sufficient amount of doses to immunize all the children. And could you mention in other countries of the world where there are outbreaks of the polio now?
It's a piece of good news that with the help of the government of Canada and the US, with the financial support, we brought in the vaccines in the country already, and we reserved the additional quantities with the manufacturer, which is based in Sanofi, which is based in France. It's a Sanofi Pasteur. The reason for selecting the specific vaccine is that this vaccine is registered in Ukraine, it's of the best quality, and there is a history of use in the country. Unfortunately, this first shipment is subject of number of speculations and wrongdoings by several people who are delaying use of these vaccines in the country and prolonging the risks to the kids of Ukraine. I think this is something which needs to be resolved immediately, and once it's resolved, the vaccines could be used. If there is a need for more vaccines, for us, the outbreak is priority. We'll definitely bring as many vaccines as possible. I have to say that we also, in parallel to this polio, we're working with the Ministry of Health to establish the procurement system of other vaccines, and we hope that we will be able to act on that very soon. There is a number of bureaucratic hurdles that we need to deal with, and I think, right now we need understanding and collaboration and support from everybody to act quickly and resolve any bottleneck for the use of vaccines. That's in a nutshell. On the issues of countries, I have to say that all countries in the world were doing this for decades. We came into the end game with the polio eradication. I have to repeat that this is not the wild polio virus, but this is the virus, as Dr. Bogomolets explained, is circulating and is causing are very serious consequences. We need to act. There were such cases of outbreaks in a number of other countries, and those outbreaks proved two things. One, that the strategy that we applied were very efficient, and the second one, that the vaccine is also extremely efficient in this kind of situations. The last message also, thank very much Dr. Bogomolets for mentioning the role of hygiene, water in this kind of situation, because it's equally important as the anything else. Thank you.
Could you specify also the countries?
In which countries there is a polio?
Could you specify the countries?
Okay, so as I'm mentioning the end game, we have, as of today, wild polio in only circulating as a wild polio virus in 3 countries: Nigeria, Afghanistan, and Pakistan. The cases of vaccines-derived polio were appearing in other countries over the past 10 years. We had 21 outbreaks in 21 different countries with 763 cases. Those countries include some countries from our region.
Nothing in Europe.
Yeah, not in our region, but you know the countries that were doing campaigns recently include Israel.
Yes, but it was in the sewage and it was wild.
Yeah.
Only sewage.
Дякую. На цьому будемо завершувати нашу прес-конференцію. Thank you very much, dear guests.
Now we will finish our press conference. Thank you very much.
Привіт до швидкої дії. От
You appealed to very quick actions from us, and we will have additional press briefing at 14:45. We will have Victor Peregrinets, Deputy Minister of Health, with a briefing on